So this is a little video to show you how to help you feed baby. Just in a cross cradle hold I'm going to show to start with. This tends to be a good way to start looking to feed baby when baby's new and you're just learning everything out. So cross cradle hold is holding baby sort of across like that and holding behind the neck. So using this helps baby to sort of move the head back, ready to feed. You can support the head and not so they don't drop too much. If you think about how you drink, you will always sort of do that, and if you try and swallow with your chin sort of to your chest, it's quite difficult to do, and it's much easier to swallow with your head back. You can try it with a glass of water or a cup of coffee, whatever you've got nearby if you want to. So hold baby like that, the breast there, now little boo, and you are looking to sort of point the nipple towards the roof of the mouth. They're looking for the soft palate at the back of the mouth. If you run your tongue along the roof of your mouth, you'll find it's hard at the front and then softer at the back. So it's that area that you're sort of aiming towards for the nipple, because with breastfeeding, babies squeeze the breast rather than suck like you'd think a straw. It's more of a squeeze. So you think if that's the tongue and that's the roof of the mouth, we're sort of looking for that, and then they squeeze and the milk will drop out at the back and down the throat. So it seems quite easy to just get it in the right point. And this is often where, if there's any pain or any sort of friction felt, that it's often that it's more feeding like that rather than that. But again, this is one side's nipple and breast, and this is a hand. It's not even a baby's mouth. So it's trial and error sometimes getting each different nipple and each different breast and each different baby. We'll do it slightly differently. And this is what you're aiming for. So baby will be moving around usually, sort of sniffing and start licking the lips a bit. So you can use this sort of to your advantage. And then if you just hold the baby and let them, they'll open their mouth really wide. You're looking for the really wide, that sort of movement. They'll do a lot of, but wait for the one where they go. And then actually quite quick, bring baby to breast, almost like that really. And then they'll look a bit startled, and then they'll start this squeezing pattern. And then they can squeeze, then they can feed quite quickly to start with, and then it could end up being quite slow, like that. And then sort of quick and then slow. And that's normal, that's totally normal to do that. You might find that they're falling asleep quickly at the breast, so you can just sort of tickle their cheeks, their fingers or their feet. Kind of reminds them what they're doing, and then they'll carry on again. If you find that there's some pain, it's a good idea to unlatch baby and try again. So to do this, you need to put your finger in the side of the baby's mouth to release the latch. Don't just pull, because the nipple will probably come too. Release the sort of suction around, and then try again and keep doing that. And get some help if you're kind of struggling with it. Just to recap on that, so cross cradle hold is across the body, holding baby inwards like that and not twisted. Again, if you're trying to drink like that, it's quite difficult. Hold them like this, and then support the head with your hand, and you can sort of guide your breast if you want. I'm holding this little boo with the other one, or you can use it if it's free hand. Sounds quite simple as I'm doing it now. It might not feel that to start with, so you might find that you want to do this. We say to use the cross cradle hold because the sort of cradle hold is a bit more difficult to do to start with. Again, once you've sort of got understood, and you and baby are understanding what each of you need, then you can start to do this. You'll start knowing how to sort of position yourself. So hold baby in a cross cradle hold, let the head tip back slightly. They'll do it themselves, but just support not so it doesn't drop. And then let them open their mouth really wide and bring baby with pointing the nipple towards the back of the mouth, the roof of the mouth, quite quickly onto the breast, and let them suckle. They'll suckle quite quick, and then it'll start going slow, and then quick perhaps again, and find what works for you. So I hope that just helps a quick, very, very quick overview of feeding baby in a cross cradle position, usually suitable for newborns. Thanks.